Got knee issues? Well, I got some tissues. Not really, but I have mobility tools that will help you get rid of those crickety-crankety and painful knees. So, before we begin, I just want to do a quick little shout out to Nadi Akubar and Kelly Starrett for kind of giving me the knowledge about mobility movement and some of the stuff that I am going to show you in this video. Now, before you begin, you will need these things, and they are a lacrosse ball, a softball, and a hard medicine ball. Now, if you're having difficulties, you could opt this out for a basketball. Just pump it up with a lot of air, make sure it's solid. Softballs, they're pretty cheap. I got this one at Walmart, I think like $1. And lacrosse balls you can find pretty much at any sporting goods store, or just order one online. Amazon's got them for like $1 or something. And of course, elbows and thumbs. And that's all you need, kiddos. So the layout of this video is going to start like this. We are going to go through a series of myofascial release exercises where we loosen up the fascia and the tissue around the knee capsule. And then from there, I'm going to show you a few corrective exercises to re-establish that neurological connection between the musculature and how you move, and how to properly fix any issues you may have with walking or running that could be causing your knee problems. So we're going to jump right into it. Please don't skip around. Follow this video and do each exercise as I'm going to show you. There's a reason it's set up like that, so be patient, go in order, and enjoy. So the first myofascial release exercise we are going to perform is a quadriceps med ball smash. It sounds painful, and it sometimes is. And the reason we're doing this first is because the quadriceps, which is pretty much this top musculature of your thigh, can become tight, especially if you're performing a lot of front squats, squats in general, and you never really tried foam rolling or performed any myofascial release in the past. This musculature can tend to tense up and become tight, which can pull your patella, which is your kneecap, upwards slightly. And over time, as this happens and kind of doesn't get broken down, it can cause issues and knee pain or discomfort. So what we're going to do is grab the med ball or your basketball, whatever you have available, and we're going to place it starting off right above the kneecap, not on the knee exactly, just right above it. So right there, and we're going to get on our forearms. You can have one arm up to support yourself if needed, and we are going to just roll the ball from side to side, and we're just rocking our leg and looking for what I'm going to call trigger points. And if you hear me say this a lot throughout this video, it simply stands for an area that you feel pain and discomfort when you're sitting on it. And it's usually not an area where you have a lot of tight fascia. So if you hit a trigger point, I want you to first sit on it. So right here, yeah. A good indication is if you make a movement with your face, you twitch, you squeeze your eye, that's a sign that that's a trigger point. Now, I want you to relax. Take a deep breath in, exhale, deep diaphragmatic breaths, and sit on that just for 30 seconds or however long. I don't only use compression as a method to break up fascia. I also like to use a method called tacking and flossing. Now what that means is, right now I'm on that tight fascia. I'm tacked on it technically. Now the flossing portion is by moving my extremity around. So I'm going to flex my leg and then extend it. And by doing this, you're tacking down that fascia and then moving your leg, which creates a shear force that really breaks it up a lot faster. So if you're limited on time, I highly suggest using a tack and floss method. So rock back and forth. You could do circles if need be. Just find those areas and break them up. And then we are going to slowly go up the leg. So you can start down low, and you should pretty much go up to where your hip is. And make sure you hit all portions of the quad, even the inside. Now, you may tend to have your knee down when you first do this because it is painful. Try to incrementally over time extend that leg out so you get more of your body weight onto the med ball. It may seem painful at first, but over time, as you perform it more and more, and just, there's a spot right there. But as you do this more and more, it will not be as painful, trust me. And now on to the next myofascial release exercise. So, we're still using the med ball and or your basketball. This myofascial release exercise will be performed on the buttocks. We are going to be doing a piriformis myofascial release. And it's pretty simple. All you have to do is take your med ball, sit up on it, prop a glute on top, and just by sitting like this, you are going to feel some pressure. And if you have a tight ass like me, then this ain't a walk in the park. And all you really have to do is just I like to start off by performing circles. So go from the center and kind of work your way around. And that's a good kind of way to hit the whole muscle and to find those trigger points. So I have one right here. I'm just going to sit on it. In this myofascial release exercise, it's a bit difficult to tack and floss, but if you want to get deeper in there, you can simply cross the leg that the ball is under on top of your stabilizing leg, which is pretty much this one. And from here, you're just going to find those spots. You want to make sure you perform this on each leg, search the whole buttocks, find those spots and sit on them. And like I said, you can spend 30 seconds, you could spend 5 minutes. The more time you spend and the more practice you get with these exercises, the more benefit you can receive from it. So there's no real determined 1 minute, 2 minutes, 3 minutes. Everybody's body is different. So, that being said, take as much or as little time as you can, but remember, more, in this case, can be better. Alright, so the next exercise that we're doing is a IT band ball smash. Now, you can either use a softball or a lacrosse ball for this. I tend to go more with the softball just because it's a little bit bigger. I can dig deeper with it, even though that kind of sounds counterproductive because this is bigger and this is smaller, but it's more dense. Lacrosse balls, if you put enough pressure, they do give in a little bit. With the softball, you're not really getting any give. So what we're going to do is position ourselves in kind of a shin box position. So your shins are forming a 90-degree angle, and we are going to take the ball and place it right alongside the right portion of our thigh. So we're going to start up here towards the knee capsule. So place the ball there, and the same as before, we are going to start by moving around, finding those trigger points, and then working our way up all the way to pretty much where the hip is. So I like to section the leg off in sections just to kind of focus more on the different areas of the leg and the IT band. For me, I have more pressure more so towards my knee itself and my knee capsule. So I like to spend more time down here. For you, you might have more tightness up near your hip, in the middle of your leg. Everybody is different. So you want to get that ball in there, roll around, find a pressure point, trigger point, something that feels tender. That's all it is. And once you feel that, sit on it. If you want to be a champ, you can try to tack and floss. It's a little bit more difficult just because of the angle of your leg, but it's not impossible. What I like to do is actually apply a little extra pressure by just gently pushing on my knee. Now by doing this, if you've been doing this exercise a lot and you don't have much tenderness in your leg or many trigger points and you need to get deeper, just apply a little pressure to your knee and you will feel a load of difference. So you start here, roll it around near that capsule. Oh, right there's a good spot. And a good tidbit too, it's actually good practice if you find a trigger point and you try not to make stanky face. Like people make all kinds of weird faces when they do myofascial release, and when you don't make stanky faces and you try to fight that urge, it's actually good if you're a martial artist or you play sports or you just want to look like a badass. Because if you could hide that pain with just a straight face, in real life, if you have a situation where you get hurt, you ain't gonna be phased, and the person's gonna be like, damn, I'm dealing with a badass. And they're gonna be scared. So, back to the exercise. And I'm just gonna go all the way up, and you want to stop before you really get too close to the pelvis or the head of the femur. So right here, I'm in the top portion of my leg, and I'm just kind of showing you an example. I don't want you to jump from knee to the top of your thigh. Slowly and incrementally go up the leg, and that's basically it. We're on the third. That is the IT band, myofascial release exercise. And a little tidbit too, if you initially feel a weird tightness or a shock or like just a pull within your knee capsule, especially when you put the ball, the softball or the lacrosse ball close to your leg like this, it's totally normal and it's okay. It's just a kind of response from your body. Don't worry, you're not messing up your kneecap or any of the ligaments or tendons within the knee capsule. So if you get scared, don't worry about it. Now for the next myofascial release exercise. So now you should probably be feeling pretty good. You can loosen up your leg. But this exercise is pretty cool because you don't really need anything except a sharp elbow. And it's also cool because you could pretty much perform this anywhere. So you're chilling with your friends, you could dig your elbow into your leg and it's perfectly normal. My friends are kind of used to it already. So let's jump into it. We're going into a shin box, and if you have not seen my mobility videos before, I made one about shin boxes, so check it out, but I'll show you a quick demonstration. So get your hands and knees and you're going to just rotate, bam, you got that 90-degree angle going on with your shins, and it kind of looks like a box, and that's what a shin box really is. So from here, we are going to actually bring the back leg just back a little bit more, and we're going to take our elbow and just dig it into the side of our thigh. Now, you may, just like the lacrosse ball, you may feel a little tightness initially in the knee capsule. That's okay. And you're just gonna start at the knee and work your way as far as you can up the thigh. Now, you want to mainly focus on this inner portion of the leg and just really get in there. If you have small elbows, like this will be perfect, but no matter what, the elbow is a perfect tool because you could really just dig in there. And once you find a spot, you can sit on it, you can push on your elbow, apply more pressure, or you could do circles and try to break up that tight fascia. That's basically it. You're just getting into that leg with the elbow, working your way up the thigh, and releasing any tension within your leg. And it's simple, it's easy. And now on to the next exercise. So now that we have the thighs nice and tenderized, like a nice sirloin, actually a fillet, I like that better. We're going to move to the calves. And what not many people know is if you have tight calves, it can really affect your knee capsule and the way your knee cap really tracks, and you may have all kinds of issues going on if you have tight calves. So what we are going to need is the lacrosse ball, and it's pretty simple. We are going to try to hit the gastrocnemius. I said it wrong. And we're going to take the lacrosse ball, so show you a little side view. And we're going to try to place it right here. And we're actually clamping our leg down on that ball. So you want to place it right about there, just right here. And try to get it as high up in that knee capsule, right, just in that crevice as you can. Now from here, the ball is wedged between my thigh and my calf. I'm going to gently grab my leg and pull it towards my buttocks, or my glutes, or whatever you want to call it. Now for me, I've performed this exercise a lot because I had tight calves, so I can get my foot pretty close to my butt without too much discomfort. Now for some people, if you never performed anything on your calves, myofascial release wise, this ain't gonna be a pretty ride, but don't worry about it. So once you're here, you want to find some tender trigger points, and if you're in this position and you don't feel anything yet, like me, what you can do is lift the ball of your foot up off of the ground, and that creates a little bit more pressure and it flexes some portions of your musculature and relaxes others. And we are going to bring our foot to the left, well, the right, and then bring it to the left. And by wiggling it like so, you're playing around and you're able to find some trigger points within that area. So just fish around and then switch legs. You can do the inner portion all as well if you have more time to spend. So you could put it right about there. Well, that's better. And same thing. Bring your foot as close as you can to your butt. Lift your ball of your foot off of the ground and just kind of fish around. And then perform it on both calves. And there you go. So that is the inner gastrocnemius myofascial release exercise. And we're almost done, so let's keep going. Alright, so inner gastrocnemius myofascial release dose. This is the second one we're doing. So we are going to get into our shin box. You could just do it the getaway like I am. And you are going to take your thumbs. If you don't have thumbs, use your elbows. And if you don't have elbows, use your nose. And you're going to place pressure right at the inner portion of gastrocnemius, right up in here. So we're going to just apply some pressure, and same thing, we're just fishing around for those trigger points, finding those tender areas that are causing issues with the knee, and then once you find it, sit on it and chill out. It's pretty simple, it's pretty straightforward. Just be careful because this section right about here can be tender for some people. So I highly suggest starting with your thumbs, and then if you're not feeling it like I am, get deep and down in there like you're a dirty truck driver and just dig in there. Just like that. That's pretty much it. Performing on both legs, and we're almost done. So, moving on to the next one. So far, we have beaten up our thighs and our calves. And you're probably thinking, John, what else is there to beat? Well, you have hamstrings, and they tend to be tight. So, we are going to do a myofascial release for the hamstring. This is one of my favorite because I hate it. And I hate it because I have some tender ass areas in my hamstrings. Now, if you don't know what your hamstring is, it's basically the muscle that goes from the crevice of your buttocks down to right around the back of where your knee is. So, it's a long piece of musculature, and it's really beaten up a lot throughout the day if you're squatting properly, walking, jumping. Now, the hamstrings get beat up a lot, they get neglected. They're like the little middle child that nobody really cares about. So, let's give that child some love. What we're gonna need is the softball and a bench. You can use a chair, and if you don't have a bench or a chair, you can do it on the floor, and if you can't do any of those, sorry, don't know what to tell you. So, we're going to take the ball, place it underneath the hamstring. I like to start kind of up high and then work my way down, but in this case, we're going to start near the knee because that's where we are focusing. So right under where the knee capsule is, you want to start by placing the ball right about there. And basically, you can lean forward, make sure you have that nice posture, and just kind of chill out. Same as before, circle around, find those tight areas. You can apply extra pressure by gently pushing onto your thigh and going from side to side, from the knee capsule end of your thigh all the way up towards your hip. So left and right, up and down, all the way up, just like the IT band, myofascial release. You can section it off and focus on different portions of your hamstring. If time's short, you can go over one pass, try to hit as much as you can. But this is very crucial. So what I like to do is rotate my legs sometimes to really get in deep, and then externally rotate a little bit, and really just kind of feel it out. You want to find those trigger points, slowly roll up the leg, and right here I have a spot and I'm just chilling. And this is not rocket science. I don't want you guys to overthink this, like, am I feeling this? I don't know what I'm feeling. Do I have to feel that? John's not feeling it. Does that mean I'm not feeling it? Oh my God. But really, don't worry about it, because to his their own. I tried to sound philosophical, but it kind of failed. But I'm mainly saying that because everybody's body is different. If I don't have a tight spot somewhere, you may not. You may have a tight spot in that location. And that is the hamstring myofascial release for the hammies. Now, onto the next exercise. So after abusing the hell out of our legs, we're going to move to corrective exercises to reteach the nervous system how to properly move and function. So this first exercise sounds simple, but it can be difficult for some people. It is a single leg balance. Sounds kind of silly, but a lot of people can't balance on one leg. Now, you don't really need any equipment, but I do suggest being near a wall, maybe having a chair nearby if you have any struggles with this exercise. So, excuse my camera angles. I'm in a confined location where one shot half my head's kind of missing and one shot my legs are missing. So I'm gonna make this work as best I can, and please just make do with what I have. So the way this exercise is going to go down is you are going to mainly put 75% of your weight on your starter or balancing leg. Now for me, I'm using my left leg as an example. Let me try to get in the shot more so you homies can see. Now, right here, I'm going to place a lot of weight onto my heel and then roll my foot forward. Try to balance that weight. You want to make sure that your knee is over your ankle. So from here, we are going to slowly take the weight off of the lifted leg, which is my right leg, and you can put your toes on the ground if you need a little balance. I would suggest, as you become more comfortable to this, to try to balance on that leg more and more. And initially when people think, oh, single leg balance, I got this, they lock their leg out, their knee is locked out, and they're like this. Now, it's not necessarily where we're going with this exercise. So you want to have that knee bent. You don't want to lock it out, because then that's equivalent to just balancing on a peg. But no, we want to attack the musculature that help us balance on that leg. So we are going to have a slight bend, still make sure the knee is over the ankle, and we're going to sit the butt back a little bit. And when I say that, I mean you are going to draw your tailbone slightly back, and when you do so, your knee will bend just a little bit more. Now from here, you should already feel a lot of the load and your glutes begin to contract. So you'll feel a lot of tension within your glutes and your hamstrings, and from here, this is where you balance. You want to make sure that you're feeling this exercise within the lower portion of your glutes, and that's where the magic really happens. And then you just balance. Hold it for as long as you can. You can start off with 30 seconds and then from there incrementally make the time longer and longer. Don't stress if you can't hold it for 30 seconds right off the bat. It's not a big deal. The main thing is just focusing on having the knee unlocked, having the knee over the ankle, and having that glute and hamstring activated. And another thing to do as well is to make sure that your foot is not collapsed. So I'm going to try to get into this camera angle. A collapsed arch simply looks like this. Your ankle is going inward, your foot almost looks flat, because a lot of people suffer from flat foot. It's a collapsed arch. And what you want to do is externally rotate that leg to raise the arch of your foot, which simply means just twisting your leg, screwing your foot into the ground, and naturally the arch of your foot will raise. And from here, it'll help create torque within your knee capsule. And I'll go over that more towards the end of the video when I start discussing proper posture and creating that torque within the knee capsule. So right now, mainly focus on that balance, switch to the other legs, rest, and do as much as you can. And now to the next one. Now for the final corrective exercise before moving on to the posture lesson. And this is pretty simple. It's basically a staggered stance exercise. Just like the single leg balance, we are just going to go into this position, hold it as long as we can, and focus on the musculature that is firing. Now this is a little difficult to get used to right off the bat, so don't beat yourself up if you can't initially balance too well or get used to it. Now, when getting to this position, you want to have your feet hip width distance apart, and we're going to just stagger our stance. So one foot in front of the other, and from here, we are going to put the majority of the weight on our front leg, which for me right now is my right leg. And you want to have that knee over the ankle and have the back leg up on the ball of the foot. So my left leg, the heel is off the ground, and my right leg is holding the majority of the weight, little bend in my knee, knee over ankle, and I'm staggered. This is the first kind of portion of it. Now here comes the more difficult part. I'm actually going to tuck my shirt in to make this a little bit easier for you guys to see. We are going to flex the one hip and extend the other. It sounds a bit confusing and it's a little bit weird to get used to it. And if you're tight in your legs and your hip flexors and everything else, you might have some difficulty here. So don't stress too much. Now, let me just go over kind of what I'm talking about. So, hip flexion is simply like so. You're closing the distance between the leg and the hip, and then extension is when you're opening that. So in the stagger position, our right leg and our right hip, we are going to flex. So we're going to aim with the tailbone and draw it back just slightly, and then with the left leg, the ball of the foot on the ground and the heel up, we are going to try to extend that hip. So when doing so, you're going to try to flatten and have a nice neutral back. It's going to look a little goofy and it's going to feel pretty weird, but as you work towards reaching this staggered isometric position, it'll help a lot with teaching your body how to properly place weight on one leg and how to balance when shifting your weight. So in this position, just hold it as long as you can, start off 30 seconds, take a break, and then incrementally increase it from there. So I'm going to go over it just once again. I'll turn this side just to show you both sides. So now my left foot is forward, my right foot is back, hip width distance apart, nothing too crazy. Majority of the weight on my front left leg, knee over the ankle, and the heel of my back leg, which is my right leg, off of the ground. Now remember, we are going to flex the right hip and extend the left. Now remember, extension, we're pushing our tailbone back and setting into the position just a little bit more, and then bringing this hip basically forward. And it's a difficult exercise. It's tough. People are probably going to think you're trying to dance when doing this, but you'll feel your glutes firing like crazy, and just hold it as best you can. And the whole reason this is a great corrective exercise is because it mimics the most functional movement pattern that every human being performs every day, which is walking. When you walk, you're distributing the weight from one leg to the other. You're constantly balancing on one leg, whether you know it or not. So this exercise helps you focus on what musculature to contract and fire and how to properly walk and move. And some people, when they're tight in their hips, that's when they tend to flare their feet out and they do the whole duck walk, which is very bad for knee health and can lead to a whole bunch of negative consequences. So perform that exercise, hold it for 30 seconds or as long as you can, and then incrementally increase it from there. Now for the posture lesson, the last segment of this video, I'm going to show you basically how to properly stand and have good posture. When people think of posture, they think of just their upper body. So they're like, oh, okay, draw the shoulders back, head up, proud chest, I got it. But then when you look at their lower body, they got the locked knees, collapsed arches, ankles going inward, valgus faults when they pick things up, and it looks ugly. Like, it's not good for your knee health, and it's not good structurally for your body. So what I'm going to teach you is how to create torque within your knee capsule and how to help raise your arches in your feet and properly stand so you avoid any of the pigeon-toed or duck feet that so many people suffer from, and I suffered from at one point. So the first lesson and the first real tip is to bring your feet and make sure they're parallel from each other, which means they're both facing same direction, and there's just two lines and they're both equal distance between the two lines. And so many people do suffer from feet in, pigeon-toed, or feet out, duck feet. So correct that, get those feet straight, and then from here we are going to create torque within our knee capsules. And this is as simple as just externally rotating our legs and screwing our feet into the ground. Now when I say externally rotate, it basically means that's external rotation. Externally, we're rotating the leg outward, but we're keeping the foot planted on the ground. And by doing this, it creates that torque within the knee capsule, and it helps raise the arch in the foot, which is natural to the human body. So you want to take your right foot, screw it into the ground clockwise, and then your left foot, screw it into the ground counterclockwise. I'm exaggerating just a little bit. You only want to use about 20% tension when performing this, but I just want to show an exaggerated version so you get the idea of what is occurring. Now by doing this, you want to unlock the knees, slightly squeeze the glutes to put that pelvis into a neutral position, and there you are. That's all you have to do to properly have torque within your knee capsules and to avoid having collapsed ankles, avoid valgus faults, and to avoid collapsed arches as well. So I'll show a little close-up of what I mean by the arch of the foot, how it's collapsed, and how it's raised by creating torque within the feet, and I'll show that now. Here's a little example of a collapsed arch. See my tootsies? Now you can notice that the ankles are facing on a downward angle towards the ground, and that my arches are completely flat. Now this is bad because you can't absorb anything within your feet if you have a collapsed arch. It's just not good for your feet health, your ankle health, or your knees. And what a lot of people tend to forget is sometimes all the issues start with the feet. So if your knees are bothering you, a big contributor to that would be having collapsed arches and collapsed ankles. So I'll show a little side view of what a collapsed arch looks like, and see virtually no arch. The ankle is basically inward. There's a little back shot. This is an extreme example, but the majority of the people I see, literally, that's how they walk everywhere. You can tell by just looking at my Achilles tendon how just far downward my ankles are facing, and it's not healthy. So we're gonna fix that. You want to make sure your feet are parallel from one another. You don't want them outwards like so, and you don't want them both facing in. You want to make sure they're nice and parallel. So from here we're going to externally rotate, and when doing so your kneecaps will turn outwards. So externally rotate, and imagine when you're doing this and you're screwing your foot into the ground that you're trying to turn your foot outwards. So I'm using my right foot as an example. I'm trying to turn it outwards without completely taking it off the ground. And when doing that, you can see my arch raised a little bit. This is an extreme example. So regular example would be this, just 20%, and that's just enough to get your arch off the ground and create torque within your knee capsule. Now with your left leg, it's the same thing. You want to imagine if you're turning it outwards, and you want to do so by keeping your foot planted, externally rotating at the hip,
which just is basically twisting your leg outwards, and bam, that's what it looks like.
So from here, collapsed, we want to externally rotate, and bam. See that difference? Collapsed arch, then externally rotated foot. Here's my other foot. Extreme example. See how it's picking up my arch? Collapsed ankle, externally rotating that leg, and the arch goes up. And that's basically it. I showed you everything you need to do to perform myofascial release to help any knee pain or knee discomfort, corrective exercises to prevent it, and to teach your body how to properly move and function, and how to properly stand and have good posture, not only with your upper body but your lower body as well. And if there was anything that you guys want me to go into more detail with, if there's anything you need me to go into more detail with, please message me, find me on Facebook, go to healthalchemisttraining.com, and I will be glad to help and make a whole video on that segment for you. So, do everything in order, don't skip around, spend as much time as you can, the more is better in these situations. And I will see you guys next time, so keep on keeping on. Peace.